Good afternoon. Thank you for joining us here on this Monday. I'm Robert Hadlock.
And I'm Sydney Benter. After 7 weeks of administering COVID-19 vaccine, CDC research shows severe allergic reactions are extremely rare.
But some people are affected. The CDC's data shows the vast majority of patients impacted are women. In the case of the Moderna vaccine, just 2.5 anaphylaxis cases are reported per million doses administered. That is a little better than the Pfizer-BioNTech vaccine, where the number jumps to 11.1 cases per million doses.
KXAN's Tom Miller asked a member of the Texas Medical Association's COVID-19 task force what Texans should take away from these findings.
What does the data say so far about how often people are having these severe allergic reactions?
We've had on the first 7 million doses under 100 patients who've had a severe allergic reaction. I remember my first grade quite well, and I learned that 100 is a little smaller than 400,000 plus, which is the number that have died from COVID so far.
Is the fact that these reactions are happening in a very few cases any reason to have some trepidation about getting the vaccine?
Absolutely not. If you've had previous anaphylaxis to anything, then you probably need to talk to your doctor about getting the vaccine.
So far, the data shows that of those with these severe allergic reactions, about 90% are women. Why is that?
We don't know, but the numbers will probably change as we have more people receiving vaccines. I know of no reason medically why women should have more serious allergic reactions than men.
When Texans see this information and learn about it, what should their takeaway be?
I've always told my patients, any drug or any immunization that I give you may maim you and may kill you, but the chances are very small. And the chances of being maimed or killed by not taking it are orders of magnitude greater.
For a full breakdown of how patients responded to the two vaccines, look for this story at kxan.com. Texas is expected to get more than 330,000 first-dose vaccines this week. Close to 30,000 of those are headed to Central Texas. Here's a breakdown by counties. More than 16,000 doses of the vaccine will end up in Travis County. More than 8,000 will go to Williamson County, 2,000 to Hays County, and 1,200 for the Hill Country and Gillespie County, 1,000 to Bastrop County, and anywhere from 100 to 300 in some rural counties. Many of those are likely to go to the 82 hubs the state has set up to help with larger community vaccination efforts, with the remaining doses of the vaccine going to 130 providers across Texas, including 9 here in Central Texas.